I'm filled with immense gratitude as I look back at my journey. In the past, I've had 2 miscarriages, 1 ectopic pregnancy, along with that added complications of fibroids. Thanks to Dr. Sabiha, whose constant monitoring and unwavering support has given me the strength and confidence throughout my journey of pregnancy, especially considering my past. Also, always being available 24/7 to take care of any questions, any doubt, any fear and uncertainty that was with me. Special thanks to Dr. Gamal, who took care of Meher while she was in the NICU, and the nurses there who took such good care that I was able to bring her back home healthy. Thank you so much. It's been quite a miracle of a delivery and a precious one too.
When Sonal entered her pregnancy this time, her high-risk factors were advanced maternal age, presence of a myoma, and a gestational diabetes well controlled. On 25th October, she let me know that she's feeling feeble baby movements. I asked her to come to the hospital for an evaluation, where my colleague evaluated her and her ultrasound parameters were fine. The baby had grown appropriately for the gestational age. The 𝐒𝐻𝐿𝐼 was normal. The CTG, which is a trace of the baby's heartbeat, had a normal baseline, but it was non-reassuring. The Doppler indices were all fine. At this point, I decided admit her and observe her and gave her a shot of steroids, which would protect the baby's lungs should we need to go in for an urgent C-section. The duty doctor called me by 2:40 p.m. Her baby movements are better. The CTG is looking fine. Shall we discharge her? I said, no, let's observe her for 24 hours. Exactly after 30 minutes, I got a frantic call from her saying, Doctor, the baby's heartbeat has dipped below the baseline. Prep Sonal up for an emergency C-section. The experienced neonatologist, Dr. Gamal, registrars, midwives, anesthetist, and a colleague at Emirates Hospital. The entire team was ready and prepped up. This was an extremely difficult and critical decision, as it did not fit into a textbook picture of requiring a C-section. But had we waited, we would have had irreversible damage. The surgery also was not an easy one. There was a 5-centimeter myoma sitting at the site of incision. Normally, we do not touch myomas at C-sections, but there was no option there. Cutting through the myoma and a very thick uterine segment, which normally thins out at term. I delivered the tiny, delicate baby in the swiftest, quickest manner possible. Meher, 1.6 kg, was born with severe anemia, and this was perplexing. There was no bleeding on the maternal side. The placental side was normal. The neonatologist suspected a feto-maternal hemorrhage. I applaud Sonal and Minal for their exceptional resilience through this tough time. It takes a lot to be a parent. Meher is now thriving with the maternal and medical attention she has got. Like the Gen Z say, no cap. As a doctor with a lot of concealed grays on my head, it is the bond of trust and optimism between the patient and the doctor that favors successful outcomes. Always wear a little sunshine in your heart.